Welcome to Orange County Car Injury Clinics right here in Santa Ana, and we focus on and specialize working with car accident injury related. Most of the injuries we deal with are back pain, neck pain, headaches, joint pain, things of that nature, tingling or numbness in the arms or hands, or even disc bulges. These are some of the most common problems that we help treat and support, not only get back to normal, but also decrease the likelihood of a permanent injury. So this is exactly, let me share with you how we help with back pain, low back pain specifically. A lot of times when patients are in automobile accidents, they not only have neck pain, a lot of times they have back pain. So we'll do what's called high sensitivity, high relevancy diagnostics. So we'll do the tests that are most likely to find the problem. So that becomes very important. One example that I give is we had a patient, was in an auto accident, and they had stationary x-rays, no motion x-rays, where motion x-rays is what should have been done to evaluate ligament tearing, but it wasn't done. That was in the emergency room. They did a whole battery of blood tests. Well, they didn't have a blood problem. It was a physical problem. They got hit by another car. And then they did their EKGs. So that was their protocol. None of it was relevant to that injury. So the patient walks out of the emergency room with prescriptions of, codeine and medication and all that, and they didn't even find the problem until months later when they continued to have problem, and then we did the workup in the diagnostics and found it. So first is to do what's called high sensitivity diagnostic testing. So to find out exactly what the problem is. Okay, that's number one. Number two is to do the proper therapeutics. And this becomes unbelievably important because when we heal after an injury, our body goes through 3 phases of healing. There's the inflammation, repair, and remodel. And if you don't get the right therapy in the right phase of healing, that's what leads to permanent injuries. I'll give you an example. So the first phase, the therapy goal is to decrease pain, inflammation, muscle spasms. Okay, so that's initially what we'll focus on. Try to get you to feel better as fast as possible. Number 2 is the repair phase. That's when the body starts producing, collagen or scar tissue. In other words, it starts to try to heal. New blood vessels, new connective tissue, okay? And that's when it is unbelievably important to receive physical medicine, specifically in all 3 ranges of motion. We have our joints, whether it's our back or neck or elbow or wrist, have 3 ranges of motion: active, passive, and joint motion. And the therapy during the repair phase requires therapy for all 3 ranges of motions, but most importantly, joint motion. And that's chiropractors treat all 3, but they're obviously very good at joint motion. That's where the majority of the problems are with these car injuries that are causing back pain. So that's the therapeutic protocol to help get that back to normal as you're healing. And then, of course, then there's what's called the remodel phase, where that tissue's not as strong, is not as elastic. So if it doesn't receive the right therapy during the remodel phase of healing, that's when the patients, or you end up with a permanent injury the rest of your life. Most likely, pain and restrictions with movement or accentuated movement is what happens. So what needs to happen in that remodel phase is some strengthening and stretching to help take that new scar tissue and collagen and soft tissue and make it stronger to decrease the likelihood of a re-injury, but also more elastic. Okay? So these therapeutic protocols are very unique and different. One thing you just don't want to do is take medication for all 3 phases of healing. You're almost guaranteed to have a permanent injury to some degree the rest of your life, in my experience. So that's what our medical team does. And again, remember, we have a medical team. So the center of our team is the chiropractor, who focuses on the spinal, the back, and the neck related problems. But we have pain management. If we need any pain management medication, we have our neurologist. If we have any nerve problems, we have our neurosurgeon for an evaluation. If we suspect any disc bulges or any disc-related problems, we have our orthopedist involved if we have any joint-related problems. We have a neuropsychologist if we have any mild concussion-related problems. So we have this whole team that supports the most common auto injuries, but the focal point is the spine with the chiropractor in the 3 phases of healing to try to get you not only have high sensitivity, high relevancy diagnostics to find the problem, do the right therapeutic protocol in each of the 3 phases. And remember, physical medicine in that repair phase is what will prevent a permanent injury or decrease the likelihood of a permanent injury to some degree in any 1, 2, or 3 of those ranges of motion, active, passive, or joint motion. So that's what we do at Orange County Car Injury Clinics. A lot of focus, a lot of education, help our patients get from point A to point B, not only with our therapeutics, our diagnostics, our therapeutics, but then also we document everything real well. That becomes very important, way more important with car injuries, especially if there's going to be a case going to court. So that takes extra education and schooling to learn the documentation and how to do testimonies and how to support the patients. So we not only will do high sensitivity relevancy diagnostics to find the problem. We'll have our therapeutics for all 3 phases of healing with our medical team. And then we have our very high sensitive documentation if there is a case. And then if there is a case that needs to go to court, our doctors have been trained in how to go to court and explain the problem to a jury when most doctors aren't willing to go to court. That's what makes the Orange County Car Injury Clinics so unique and different than any other type of healthcare providers relative to car injuries. Now, again, if you've been in a car injury and are suffering from these problems, give us a call. You can call us at 949-207-7117. And when you do call, if you're involved in a car accident, it's covered 100%. We'll just verify that. We'll see you immediately, either that day or the next day, typically. When you do come in, we have what's called a 7-minute wait policy. You'll see the doctor within 7 minutes. We're going to respect your time. When you do come in, it's only going to take about 20 to 30 minutes. We're not going to keep you there all day or a half a day. Again, we're going to respect your time. And we open as early as 9 and close as late as 6. So that helps quite a bit. So you can either come in before work, during lunch, or after work. It makes it real easy. And we do have what's called a 72 hours right to refund. In other words, we'll guarantee you're 100% satisfied in the first 72 hours, or it's any funds you did pay is 100% given back to you. Now remember, if you're in a car injury, your car accident insurance pays at 100%, so there's no cost for that. Now, if you're not in a car injury and you have back pain, then we have what's called our new patient special. So we make it easy for you to see if chiropractic can help you. Number 1 is we do a private consultation with the doctor, see if it's a problem we think we can help. Number 2 is the new patient special will include range of motion tests to see which motions are restricted or causing the problem. Remember, there's 3, active, passive, and joint. Then we'll do nerve tests, see which nerves are involved, so we know exactly what therapies or what nerves to treat. We'll do muscle testing, so we'll know exactly what muscles are involved or weak or damaged or injured, so we know exactly what therapy to apply to which muscle group. Then we'll do orthopedic tests to find out the joints that are causing the problem, again, so we know exactly what to treat. It'll include 2 to 4 x-rays if it's needed, very important. The new patient special also, so not only will we do all those tests to find the problem, to see if it can be helped, but we will also include 3 chiropractic treatments to see how you start to respond, how favorable you respond, how quickly you respond to treatment, and 3 anti-pain muscle therapies, so to help decrease the pain and muscle spasms. 3 therapies to help decrease pain and muscle spasms. So you get all of that with the new patient special. Now, it typically costs $350. The new patient special is only $97. Now remember, that is if you've not been in a car accident and you just have back pain. So if you've been in a car accident, it's covered 100%. So there you have it. We make it easy for you to get in, see if we can help you, get you feeling better quickly. And if there is any problem there, We want to make sure we document it real well, and we want to make sure we can go to court if necessary and testify that, yeah, this is the problem you did suffer as a result of this auto injury. So that's what makes us so unique and special than just the general chiropractor or the general, medical doctor practicing who have not been trained in those specific skill sets. So give us a call. We're Orange County Chiropractic Injury Clinics. We can get you in, chances are today, if not tomorrow. You can give us a ring. We're right here in Santa Ana, California. You can call us at 949-207-7117. That's 949-207-7117. Give us a call. We look forward to helping you immediately.